Hi, it's Crystal. I'm back. So your electrolytes look good. My name is Crystal Pernasilice. I'm an advanced practitioner here at GBMC, working mostly in internal medicine. I was reviewing your lab work as we talked about. So I really wanted to go into the medical field. I really like being able to help people. I like the science behind the medicine and helping people feel comfortable and get well and get to go home again. I like working in the hospital because it's more upbeat, there's a faster pace, there's a lot going on. So I just saw this report. We gave him the 25% yesterday, as we discussed. Yes, he feels fine. As an advanced practitioner in the hospital or any setting, we're a provider. So we work in conjunction with the medical team, the doctors, nurses, therapies to help provide, all around coverage for the patients. A typical day for me would consist, well, there is no typical day. We talked about how your blood pressure had gone up a bit yesterday, but we treated that. In general, we come in, we cover for the doctors that are not available at that time in the hospital. So we figure out how many patients we're covering in the hospital, what services we're covering for, and then we divide up the patients among us. So then we would round on all of our patients, we check their labs and imaging and whatever studies are back for that day, and we see them, interview them, look at the events for the last 24 hours, talk to the nurses, examine the patients, and then help to formulate an assessment and a plan of what we're going to do for that day.
What's it today?
It was down lower in the 2s, I believe. Let me see. 2.8. Sometimes, especially with some of our older patients, because advanced practitioners are a newer addition to the hospital, they are not familiar. So sometimes it just requires a little of explaining. This is who I am. I work closely with your doctors when they're not available. And most of the time we don't run into any problems. So when we're talking to the patients' families, if we can get them to come into the hospital where they can meet the team and see their loved one and see what we're saying, it's always easier for everyone. However, that's not always the case. Sometimes these people are very far away, so we just have to be able to answer all of their questions so that they know that and feel comfortable that their loved one is being taken care of well. Here, let me put this down for you. So I think advanced practitioners in general, as a group, we like to work with people, we like interaction, we like to talk to the patients and hear what they have to say, and that helps us treat them as a whole person. And I think the patients really appreciate us being available and there to listen and incorporating everything they tell us into their treatment plan. As an advanced practitioner, we can practice in any setting. We can do inpatient, outpatient, OR. So our particular group, we cover medical patients, surgical patients on all of the units in the hospital. And then we also have some of our department that goes into the OR as well. He has the gram-positive peroxide. He's going to get an echo today.
Okay.
Yes, again, in his second set. As far as a motto or a way to practice medicine, I think GBMC sums it up pretty well, and just to take care of the patient, every patient, as if they were your family member or your loved one. Is that good for you? I figured you would like that. Do you need anything else? That's the biggest benefit I think that we serve to the group we're caring for now, is their physicians can't be available, but we are here 24/7, someone from our department, so there's always someone available to go and actually look at the patient and assess them and examine them. And I think they do appreciate that. Your lungs are nice and clear.